Hello, my name is Sarah Hess. I am the Marketing and Communication Director here at Haxtun Health, and I want to welcome you back to our Health on the High Plains YouTube series. Now, in our first episode, we touched on our direct access testing and what that is. And in today's episode, we're going to dive a little bit deeper into one specific test, and that's the CBC. So join me as we learn from Dr. Judd as to why that test is so important for you and for you to know your levels.
Hi.
Hello, Casey. How you doing today?
I'm doing good. How are you, Dr. Dawson?
I'm doing good. I have to give the legal disclaimer before we start talking, though.
Yeah, go for it.
So, this video is meant for educational purposes, and as I am not your physician necessarily, it's just meant to give you some ideas to go off of so you can talk to your provider if you need to. Please don't accept this as professional medical advice from me, even though I'm a doctor, because I'm not looking at you and I can't tell you exactly what to do. Thank you very much.
All right. Well, I was wondering about CBC lab tests. Why would I want one?
Perfect. So that's a great question. So CBC stands for complete blood cell count. And it talks about your white blood cells, your red blood cells, your platelets, and the different kinds of those, the sizes, etc. It's actually a really cool test. It's done by a machine that runs your blood through a single file, one cell at a time through a little opening. It can measure how big it is. It runs lasers through it. They can see what kind they are. It's fantastic. It's called flow cytometry. Just as an aside, if you want to Google something and learn something fun.
Wow. Okay.
The reason you'd want to do it is to look for infection, look for different kinds of inflammation, look for anemia, like your platelets aren't, your blood isn't clotting, you're getting lots of bruises, you feel fatigue, sometimes even headaches. So if you get headaches chronically, sometimes it's because your red blood cells level is too high and your blood is like sludge and your poor heart's pumping mud around and it gives you a headache just from that.
Yeah.
So that's kind of a quick rundown on why you'd want to do one. And we have that available on our patient-directed testing here at Haxtun Health, and hence I feel like that's a great question.
Yeah, absolutely. Well, you gave me a couple examples, but what other diseases could be found from a lab test like that?
Excellent. So leukemia, sometimes lymphoma, sometimes we can catch gout and other inflammatory processes, even rheumatoid arthritis, because the white blood cell count goes up with inflammation, and all of those are inflammatory processes.
Wow.
It makes it difficult to interpret sometimes. So sometimes you can have a red painful joint. Is it gout? Is it an infection? Your white blood cell count will be high with both, and you need some extra testing usually to help sort that out. Right?
Yeah.
Other things would be sometimes B12 deficiency will show up on a CBC. We can help determine that. B12 deficiency can cause permanent nerve damage. It's definitely worth looking into.
Yeah.
You'll get like numbness in your feet for no apparent reason, and you won't be able to feel the floor as well. That's one of the symptoms of that.
Okay. So if I get a CBC lab result and I type it into Google and it says that I'm fine, but I still feel awful, what should I do?
So interpreting labs isn't necessarily, hey, it's high or low, and it means something. Sometimes it's the nuances of those labs. Sometimes it's almost abnormal for the population at large, because that's where normal lab results come from, the normal values we use.
Yeah.
But it may not be normal for you in those circumstances.
Okay.
And so if you don't feel good, and even though you got patient-directed testing or however you got your labs, and just something still feels off, it's probably worth talking to your doctor about it to find out what else needs to be done.
Okay. So I was worried that I might have leukemia, and then I got that lab result done, but it doesn't really show anything.
Mm-hmm.
So I don't know how to go about, I don't want to ignore them.
Right. So let's say you do patient-directed testing or you got labs done and some of your values are a little out of whack, and you punched it in Google and it says, hey, you have leukemia, and you feel kind of bad.
Yeah.
Definitely go to the doctor, get checked out. There's lots of ways to treat leukemia now that didn't exist before. So that's one side. The other side, so let's say you feel bad and all your lab results come back normal, kind of like we talked about before.
Yeah.
There are ways of doing additional tests like bone marrow biopsies, etc., depending on your particular circumstances and other lab results that may need to happen to sort out what you have going on.
Okay. So that's not the only option you can do. You
No.
can choose multiple ways.
Yeah. In this day and age of technology, fortunately or unfortunately, however you want to look at it, there's almost always more testing we can do.
Yeah.
And it's the job of the provider and yourself to advocate for yourself to help sort out like what is the next step that makes sense in your particular instance.
Okay. Well, that's perfect. You've answered all my questions, I think.
Thank you, Casey. Really appreciate your time today.
Thank you.
That was such great insight as to what a CBC panel is. Thank you, Dr. Jed, for answering all of our questions. And thank you for watching our second episode of Health on the High Plains. If you have further questions about direct access testing or anything in the medical field, please feel free to leave comments in the comment section and we will address them as soon as possible. And you never know, it might turn into its own episode. So thank you again for watching and stay tuned for more episodes.